I'm Kate Thomas, and together with Loren Katchel from the Princess Alexandra Hospital, we have collated a case study on the utility of 18F-FDG PET MR imaging in patients with aortitis. Aortitis is a form of vasculitis and is traditionally described as an inflammatory change involving one or more layers of the aortic wall. Aortic wall inflammation can be infectious or more commonly non-infectious. IgG4-related disease is a non-infectious cause of aortitis and is largely a heterogeneous disease that can often present with multi-organ involvement, seen commonly in salivary glands, the pancreas, and vasculature. Diagnosis can be difficult and treatment depends on the source of inflammation. A 66-year-old male with ongoing back pain was referred for a lumbar spine CT, where a 10 centimeter infrarenal abdominal aortic aneurysm was found incidentally. The patient was admitted for surgery where he had an open AAA repair. Intraoperative histology was suspicious of IgG4-related disease, but infectious aortitis could not be completely ruled out. 2 months post-surgery, 18F-FDG PET MR imaging was performed to determine differential diagnosis and assess disease activity and organ involvement. The PET images demonstrated mild to moderate FDG avidity in the interior wall of the native aneurysmal abdominal aorta, with the MRI sequences noting irregular wall thickening and enhancement. Increased FDG avidity was noted in the parotid glands bilaterally, indicative of parotitis, which supported the histological findings suggestive of IgG4-related aortitis. After diagnosis, the patient received 2 rounds of monoclonal antibody treatment and underwent MFF therapy. Post-treatment, a follow-up PET MRI demonstrated considerable disease regression with no new FDG-avid disease. The PET images provided useful functional and pathophysiologic disease assessment, while the MR imaging offered superior contrast resolution for vessel wall evaluation compared to CT. PET MRI also has the advantage of a lower radiation dose than PET CT, which is particularly beneficial when follow-up and therapy monitoring is required. Overall, this case demonstrates the utility that 18F-FDG PET MRI has in the diagnosis, differential diagnosis, evaluation of disease extent, and monitoring of therapeutic response for patients with aortitis.